1370 AM, 96.3 FM, The Source.
Don't look now, but the world is changing, Robin.
Yes, it is.
It is changing. It's unbelievable. I mean, if you look at the different things that are now in our world that seemed like science fiction just a few years ago, there's so many things I could follow that with, whether it's technology or medicine. One of the areas of medicine is what we call plastic surgery. It's I don't know if it's a misnomer or not. I know I've been told the reason it's called plastic surgery. But I guess the important part about that profession is that the doctors who are able to do that can literally bring a person's life back around. They may have been disformed in a fire or maybe there's something they were born with and they thought they were never going to be able to speak normally or even see. We know some children from the Children's Craniofacial Association that we volunteer with, and some of their surgeries, they have hundreds of surgeries sometimes, right? And most of it isn't, I guess, considered cosmetic. It's more medical, right? Mm-hmm. But then toward the end of their surgeries, like when they're almost done, then they start getting the cosmetic surgeries, and oh my gosh, it just turns their lives around. Dr. Jeffrey E. Janis probably knows way more about that than we ever will. He is a professor and executive vice chairman of the Department of Plastic Surgery at the Ohio State University Wexner Medical Center and the president of the American Society of Plastic Surgeons. He's on to talk to us about finding the right plastic surgeon for a better and safer plastic surgery. This is another field that has made leaps and bounds. Anything you think you know about plastic surgery probably has changed, right? Good morning, Dr. Janis. Nice to have you on the air with us.
Good morning. Thank you for having me.
Are you in Ohio right now?
I am in Ohio.
How's the weather there? It's got to be really
not as good. Not as good as what you're enjoying. We're probably catching up to you. We have just finished our last snowfall probably 2 weeks ago.
So you're going to give us advice on... That's amazing. 2 weeks ago. I didn't mean to just brush over that. So you're going to give us advice on finding a plastic surgeon. Do some of us look for plastic surgery that you feel maybe just leave things the way they are?
Well, I think it's important, to find a qualified professional to do plastic surgery. In a nutshell, when you're considering, and to your earlier point about maybe craniofacial deformities and reconstructive surgery, whether you're looking for a plastic surgeon for cosmetic purposes or whether you're looking for reconstruction, you want to find the right person for the job. And that's why here at the American Society of Plastic Surgeons, we have board-certified plastic surgeons, meaning they've gone through the proper training, years of training, oftentimes 6 to 9 years of training or more before we go out and practice. And so if you're interested in finding somebody who's qualified to perform your plastic surgery, just go to our website, www.plasticsurgery.org.
There was a story yesterday about a woman. She was in the Army, and she had her ear cut off in an automobile accident, not in combat or anything. And they were regrowing an ear in her arm that would later be reattached to her head. That's amazing to me, but I'm wondering, is that as difficult as other plastic... I'm thinking when you're working with the head, it's got to be hard, right? Anything on the head.
Well, plastic surgery is all about innovation. So that's one thing that our specialty has owned for really for centuries. When you take a look at what people lose, whether it's an ear in this case, as you mentioned, or you mentioned car accidents, you mentioned sometimes people get their hands caught in lawnmowers and cut off fingers, hands, even arms. That's a situation where plastic surgeons can help because we involve moving tissue around. Sometimes we can just use tissue that's right around the area. Sometimes we have to move it from far away to from one place to another. But that's what plastic surgeons do. We innovate and we create, and to your earlier point, we give people back what they're missing. And I'm not just talking about an ear, but quality of life.
So go ahead.
You talk about the three R's of plastic surgery. What are those?
The 3 R's: results, recovery, and risk. any procedure that you get is going to involve some risk. The question is do you spend more time researching what vacuum cleaner you're going to buy, or do you spend more time figuring out what surgeon you want to help restore what you're missing? And so there is some risk. So when it comes to finding a plastic surgeon, that's why I was suggesting that you find somebody who's board certified by the American Board of Plastic Surgery, and also that your surgery is being performed in the right place. And by that I mean what's called an accredited facility. Believe it or not, you can go on to the news right now and find examples of stories where people are getting plastic surgery performed in closets, basements, tents, barns. You think I'm making this up, but I'm not. And you would think that this is maybe something that would appeal to common sense, but that's why we're here. That's why we're talking about this. If you're trying to find the right surgeon, it's not only the right person, but the right place. So you really want to minimize the risk. You also want the results. And one good way to find results is many of us on our own websites have before and after photos, and also good old-fashioned word of mouth. Many times people who have been to a plastic surgeon are a great source of information. They're great resources to tell you what was their experience like. And then finally, recovery. You can't get something for nothing. And so whether it's the needle or the knife, and by that I mean whether you're going into the clinic and getting, let's say, injections of Botox or fillers, or whether you're getting surgery, there is a recovery period to it, and that's what your qualified professional will help advise you of.
So in finding a professional that works with you the best, I'm wondering if there are two parts to this, and that would be the cosmetic, which maybe isn't covered by insurance, and then the medical, which might be. And please correct everything I'm saying that's wrong in just a second. But I'm often thinking that an insurance a procedure that's covered by insurance, it might be easier to have one professional recommending another one. But cosmetic, is it the same way, or am I wrong across the board? Does insurance cover all plastic surgeries?
No, I mean, and you've got it right. Insurance doesn't cover everything. Generally speaking, insurance is going to cover the reconstructive surgery, whereas stuff that's done for cosmetic or aesthetic reasons is usually not covered. But I would also even go so far as to say that they're really two sides of the same coin, if you think about it. If you get a facelift, that's cosmetic. But what about that child you talked about earlier who has a craniofacial deformity? Or what about that woman you talked about earlier who was in a car accident and maybe got disfigured?
Right.
You know, there's a cosmetic aspect to it, and there's a reconstructive aspect to it. Think about the women who have breast cancer, and you're reconstructing a breast after they get a mastectomy. Nobody's going to argue that there's not a cosmetic side to that too. And so generally speaking, insurance will cover reconstruction, but there's always a cosmetic side to reconstruction, just as there is the flip side.
But I guess specifically the question would be, does the insurance company have the resources to recommend a good doctor?
What the insurance companies usually have is which doctor is on their plan, and that's going to vary based on insurance company. But that's where I would advise you and your listeners that when you're looking at the names of the plastic surgeons who are on your plan, first of all, make sure that they are plastic surgeons that are board certified by the American Board of Plastic Surgery. And
that's the key, right there. Yeah.
That's right. And these are members of the American Society of Plastic Surgeons. The easy way to do it, quite honestly, for your listeners, is if you're looking at your insurance plan, trying to figure out who's on it, and you see some names, just go to that website I talked about earlier, www.plasticsurgery.org, and type in the name. It'll tell you if they're a member of the American Society of Plastic Surgeons. That'll guarantee you that they are board certified and operate in accredited facilities.
And you talk about non-invasive cosmetic treatments.
That's right, and that's more the needle. More than that, we talk about sometimes freezing fat. You might have heard of that. Things that can be done in the clinic. And of course, you need your board-certified plastic surgeon to help advise you whether you're a candidate for that. Not everybody is a candidate. I'm sure everybody would like to have non-invasive plastic surgery. The question is whether they're appropriate for that or not. Nobody, especially if it's cosmetic and you're spending even $1, you want to make sure that you're getting value for that dollar and that you're seeing the results.
The website is plasticsurgery.org, and I just went to the site, and it looks really easy to navigate, so it should be a really useful, helpful tool for you. There's an 800 number on it. Is it okay that I read this to the listeners?
Yeah, of course. And also you might want to mention the Find a Surgeon function, because you literally just type in a name and it tells you right there. But please go ahead with the 800 number.
I got you. Yes, it's 1-800-514-5058, and you use that number to find a plastic surgeon in our area.
That's right.
Are there any that you know of that are in Central Florida? I won't narrow it down to our city, but maybe Orlando or Tampa? Or...
Well, I got to tell you, you are very lucky in Florida, because there are a tremendous number of very highly qualified ASPS members, that is the American Society of Plastic Surgeon members, all over the state of Florida, not just Central Florida. You really, if you look at every state, really California, Texas, Florida, New York, those are the states that actually have the most plastic surgeons in it, and so Florida has got no shortage of highly qualified professionals.
And you certainly are very caring, sir, because when people do need plastic surgery, they want to get the best possible plastic surgeon there is, and they have to know which ones are the best and which ones are not for their total overall health.
That's right. I don't think anybody could have said it better than what you just said.
Well, I just went on the 3D thing, and I'm looking at a 3D butt. That's pretty awesome. See my screen here, Robin? If anybody walks past right now, they're going to say, "What are you looking at on there?"
There you go.
Doctor, thank you for being on the air with us to share this with us. Again, the website is plasticsurgery.org. Dr. Jeffrey E. Janis, thank you.
Yeah, thank you. Have a great day.
Thank you. You too, and happy Mother's Day.
Thank you.
We'll take a little break. Be right back.
Alone or in conjunction with implants. Augmentation with implants, which
Here is your one-minute news brief from the source, WOCA. U.S. Senator Bill Nelson is calling on federal authorities to reject the proposed change to Florida's Medicaid program after Governor Rick Scott asked for approval to shorten the amount of time people can apply for Medicaid. A Marion County Sheriff's deputy is being credited with saving a baby's life. The baby is expected to make a full recovery. And by the way, Deputy Jeremy Nix is the husband of Nikki Nix, heard each Tuesday on WOCA during our visit with Ocala Eye. A group pushing a constitutional amendment on gambling is getting a